Dr. Drew, it is so good to have you on. I know Americans want to hear your voice. How are you quarantining at this point?
I'm quarantining, and I am depressed. I don't know about you, but I'm getting tired of this. It's rough.
I know I'm a white guy, but I'm getting awfully white here in the dungeon of the studio.
Hey, listen, that is a really important point, is that I was 2 days ago worse than I am now, and how I turned it around was sunlight, just getting outside, taking a run. I mean, it really makes a difference.
Don't they say vitamin D from the sun? Isn't that good for you? Good for the immune system?
It is good for you. It has good antiviral properties, but more importantly, it's good for your mood.
I know there's a lot of people out there on social media that claim they're a doctor. They claim they're a specialist when it comes to these viruses, along with members of the media. I know that you are a doctor. We remember you from Love Lines. Of course, Dr. Drew, the After Dark podcast is on. You can check him out and follow Dr. Drew Pinsky on Twitter. But could you give the audience your official credentials? I know we call you Dr. Drew, but before you dive into this thing, exactly what qualifies you to being a doctor?
Thank you for asking that. Not enough people ask people for their credentials, and people that have real credentials are happy to share them. So I graduated medical school in 1984. I did a internal medicine residency and did a chief residency in 87, 88. I then taught internal medicine for a few years after that. Found my way into working in a psychiatric hospital where I became the chief of their medical services and then program director of chemical dependency services. As a result of that, I became I got my board certification in internal medicine and then board certification in addiction medicine. Over the years, I've had assistant clinical professorships in psychiatry, adolescent pediatrics, and general medicine.
Sounds like you are officially a doctor, and that's why we have him on. Dr. Drew Pinsky now joining us. So we have like a psychology problem. You brought up your expertise in psychology. This is, I think, also causing a problem. My father had a heart transplant, kidney transplant, so he's one of these guys that walks around really worried, and I'm actually worried for him. I don't really worry for myself so much, but this has really gotten into his head. So I'm trying to keep him optimistic. I know he's probably going to listen to this podcast, but you have been the voice of reason. Do you still stand by your quotes from a few weeks ago where you were feeling like this was more media-driven panic than the actual virus itself?
I still feel that the media has driven the panic, and we need not panic. It's a serious situation we need to take seriously. Listen to Dr. Fauci and the CDC. Do exactly what they tell us, nothing more, nothing less, and we will be fine. But no one is it more important to do so than people like, is it your father-in-law?
Yeah, my dad. My dad had a heart transplant 15 years ago.
Your dad needs to pay attention. He needs to be. Guys like your dad need to be in a systematic quarantine, and probably for the next. He is the kind of person that probably for the next couple of months. Now, how old are you?
I'm 41.
Yeah, you are probably. I know you're working now, but let's say you were working somewhere where you had been laid off or quarantined or locked down. You probably would be the kind of person that could go back to work in a few weeks, potentially, depending on where you live. If you live in New York City or Washington, maybe not so much. But if you live in Texas, well, there's a real probability. Test you for the virus, test you for the antibodies to the virus, and let you practice social distancing while you return to work. Folks like your dad, no. We're going to have to handle that very differently. And his physicians are going to need to stay on top of him. There may be a chance for him to take prophylactic medication, preventative medication. I know that doctors and nurses now are giving it to themselves. It's called hydroxychloroquine. It's also being used routinely to treat the illness and to reduce its infectivity. The data will be out on that in a week or so. Right as we start to lift this thing a little bit, people like your dad may be able to take a medication that will help prevent the illness. That will be really interesting if we get to that point.
We're talking with Dr. Drew. Make sure you check out his podcast. It's called After Dark. You can follow him on Twitter. He goes live on Periscope. Look out for that hashtag Dose of Drew. Right now, as far as timeline goes, how do you see this thing playing out when it comes to, if you wanted to make some assumptions on fatalities and how this is going to affect our economy moving forward?
Well, there are multiple different questions there, right? I believe the fatality rate will come down as we find out that more and more people were infected with this thing. but it's still, it causes hospitalization at a higher rate than the flu, and it's more infective than the flu, and it will still have probably a higher fatality rate than the flu. The interesting thing will be whether or not the hydroxychloroquine can drop that down to the point where it is essentially the same as the flu, and we don't know that yet. In terms of the impact on the economy, that is gravely concerning. People need hope as it pertains to that. They need to understand what the road out is going to be. People's lives can't be destroyed by this thing. We have to find a middle ground where we allow people to return to living. And that's going to be done on a regional basis. It's no longer makes sense to talk about a national epidemiology because every region is so different. New York City is different than Oklahoma City. They're not the same. And if we can get more information through testing on where it is, how it breaks out, where people are immune, we can certainly let people that are young and not at risk return to work. Because even when they get this thing, 80% of people are barely going to know they have it. It's going to be a mild illness. And so it will be time in a couple of weeks for us to start systematically rolling people back in stages towards economic engagement, but not without it being not everywhere the same and not without some sort of systematic plan.
We're talking with Dr. Drew. You know, I was listening to your podcast. I think it was on Twitter this morning. I was checking it out. And you were taking some live calls from people in New York City. We're based out of South Florida. We do broadcast to the world, but here in South Florida, it's not too bad. You were able to communicate with a lot of people in New York. Is this thing really as bad as the media is making it seem? You know, whole floors of people in a hospital are dying, or is this, again, more fear-mongering?
It is. Whatever you're seeing out there, it's fear-mongering. I just think about the New York Times and the fact that they were printing on their front page above the fold every day, all last week, data that was clearly false, which was these doomsday scenarios out of a university in the United Kingdom that was suggesting, millions of Americans are going to die. It's not going to happen. It's just not going to happen. We're not going to let it happen. We are taking aggressive action. We're doing what we need to do, and the U.S. healthcare system flexes, delivers care, and innovates better than any system in the world, and we will get it done.
We're at a time now, too, Dr. Drew, where we just don't trust anyone. We hear about the fake news. You just mentioned the New York Times. You got CNN saying one thing, then you tune into Fox News and you hear another thing. Who do we trust at this point?
Trust Dr. Fauci. Dr. Anthony Fauci, I've been alongside of him since the AIDS days. I was deep in that epidemic, and he was my guiding light then. He is my guiding light now. If you can't hear from him, if you don't hear what he's saying directly, you're not listening to the press conferences, go to the Centers for Disease Control, the CDC website, do exactly what they say. Don't do more, don't do less, and we will be fine.
Now, what about these crazy conspiracy theorists? Like I have a couple of friends that are claiming that this is a lab-created coronavirus, that there's going to be mandatory vaccines. That's all part of the agenda. This is a covert U.S. intelligence operation. Hollywood people are going to get arrested. Global elite are going to get arrested. Human trafficking, awful crimes. What do you say to those conspiracy theorists? Is there any truth to this?
I would spend that time and energy maybe writing a screenplay. It sounds like a pretty good movie, but it's not reality. How somebody could systematically control something like this and play it out and seem to know how it would play out defies. I mean, I guess if we, I'm joking, but I wonder if we had artificial intelligence ruling the world, if AI could imagine and control something like this. Even that, I don't think it could do it.
It is pretty crazy. Yeah, I have one friend of mine who says, watch Madonna's Instagram. She's out of adrenochrome, and that they're drinking baby blood, and that now Ellen and Madonna are without their adrenochrome. What is this adrenochrome? Have you heard of this stuff?
No, what is it? It's comical. What is it?
I guess it's something to do with sacrificing young children, and they drink the blood, and it makes them feel young again, and that's what all these Hollywood celebrities have been doing. And now Donald Trump has cut off the supply, and he's going to go in and arrest them. Be careful with
the people that are saying that they may need medication soon.
They may need to come see Dr. Drew.
Yeah, well, yeah. I mean, that kind of paranoid ideation can be a sign. It can be a sign that that's our brain does that when it's not working properly, and people without mental illness can sometimes go down those rabbit holes. but it also can be a sign that somebody's getting into some real serious trouble. And again, this is one of the concerns I have with the way the press is hammering the panic, is that you're going to harm people. You're going to harm them, and that's not okay.
Anything exciting on the show tonight? Should we tell our audience to tune in, and where can they check out your show, After Dark, the podcast?
Well, After Dark, everything's really at drdrew.com, and I do a streaming show every day where you heard me yesterday interviewing somebody from New York, where a friend of mine I was just trying to get, who lived across the street from the Javits Center. I just was trying to get a on-the-street view of what's going on. And, a young, healthy person is not really worrying too much, even in New York City. They're doing fine. They're doing what they need to do, but they're doing fine. And I'll be streaming every day, just answering your questions. We actually do a call-in show on Sunday where I'll actually take calls, and it's all at drdrew.com.
All right, well, check it out. Dr. Drew, thanks for your time, and stay safe, and really appreciate you coming on with us. Have a good one.